Welcome once again, ladies and gentlemen, to yet another episode of Health, Hygiene and Wellness. Thank you so much for watching Imani Television. I hope you are getting refreshed and nourished spiritually by watching this channel. Now, today in our program, Health, Hygiene and Wellness, we are going to discuss about hypertension once again. It's because the month of May is a hypertension awareness month, where we are creating awareness in order to reduce the cases of hypertension, and also to make the I don't want to say victims, but those who are affected by hypertension to be aware of the disease that they have, and they can take care of it in a much good way. My name is Barasa Saenyi, and today in the show we have Dr. Silas Wambulwa from the Trans Nzoia Teaching and Referral Hospital, and we'll be discussing much about that. Karibu sana daktari kwenye program.
Thank you so much.
How have you been?
I'm good. Thank God. Yeah.
Once again, we are talking about hypertension.
Yes.
And from some of the statistics that I've been checking is that over 10 million people around the whole world are living with hypertension. Actually, 10 million people are the lives that we lose every year over hypertension, and that 50% of the people that are having hypertension are not aware of the disease that they are having. So there is need for more awareness to be created in order to reach these people, so that we can educate them to go for screening and much more. But I know in the program we'll be talking about that as we continue. Now, maybe we can just begin on this note. How can you rate the state of hypertension right now in the whole country?
Thank you so much, Saenyi, and I think it's a good question. Hypertension is the #1 killer disease in the country currently. Cardiovascular disease is the leading cause of death, and it has overtaken infectious diseases like malaria, TB, and any other conditions, even HIV. HIV is no longer causing so much deaths like it used to. Malaria is no longer causing so much death like it used to, and you know the interventions that have been put in place, mosquito nets and other things. But unfortunately, we are losing lives. Even if I ask you today, the last person that unfortunately you buried in your life recently, likely they were because of hypertension. So we classify them under cardiovascular diseases, and they are the leading cause of death. They are the leading cause of morbidity and mortality. That means that many cases of hospital admissions nowadays, they are coming because of hypertension. And many cases of deaths are coming because of hypertension. And secondly, it has taken a different trend. You know, initially people used to think hypertension is a disease of the rich, but currently it is affecting more the people who are living in low socioeconomic status. You know, people used to think hypertension affects most people from the US and the other countries, the European countries. But currently, when we look at World Health Organization statistics, they are saying it's going to be a catastrophe in the next 10 years for the low or middle-income countries, Africa included.
What can we attribute it to, the rise of hypertension cases?
In the low-income countries. Yeah, it's because of the changing trends. You know, also the low-income countries are coming up. Unfortunately, they are coming up, but they don't have the right measures to put in place. For example, awareness of hypertension. Many people they don't know that when they reach 40 years, they are supposed to check for blood pressure every year. There are people who have lived even to 40 years, 30 years, and you ask them, have you ever checked your blood pressure? They don't know even how to do a blood pressure check. So you can imagine, and you know, there are very simple measures to prevent hypertension. Because hypertension, when it's there, it does not give, we'll discuss it later, it does not give you symptoms. So again, that lack of symptoms to the Africans is a very bad thing, because many of us Africans, we want to look at the symptoms.
We want to see them.
Yes.
We want to feel it.
For a disease like hypertension, it does not have symptoms. So you will just fall sick, and no one knows you are sick until another time when you get a stroke. That's when your community members realize that you are sick. And even you yourself, you will be shocked because you couldn't know that you have hypertension, and yet it was there. Yeah.
Now, if we can begin, you see, maybe we are talking about hypertension, and our viewer right there maybe doesn't understand what hypertension is, maybe you can define what hypertension is so that they can have an idea of whatever it is.
Hypertension, maybe I can define it in Kiswahili. It comes better in Kiswahili. Shinikizo la damu. Yeah. Or consistently elevated blood pressure. You know, when our heart pumps, there is what we call blood pressure. So blood pressure is something that you start having when you are young. You know, for you to live, you must have a certain level of blood pressure. So that blood pressure is what pumps blood in your arteries every day, so that you can be able to serve the organs and everything.
Is it about the speed that blood flows in our veins and arteries, or it's about the amount that is in the blood system?
Yes, both. The amount, the speed, and the resistance. There are three things. There's a lot of physics there. We use a lot of the Boyle's law, Charles' law. If you remember those things,
yes.
we use that to calculate the blood pressure. So whenever the heart pumps, it will look at the resistance of the arteries, the size of the arteries, that's lumen.
Yes.
The size of the artery and the strength of the heart, maybe what we call the cardiac output, the amount of blood that has come from the heart. So when you want to measure your blood pressure, we look at the amount of blood that is passing through your artery. Mostly we like using this brachial artery, the artery on your arm. So this artery is the one that helps us get the blood pressure.
Yes.
So if somebody has hypertension, it has to be consistently elevated. You know, anything can happen in this room right now. Maybe a snake can come in and everybody's blood pressure will go up. So if we test your blood pressure at that time and we find it's high, that's not hypertension. Hypertension, you have to go for 1, 2, 3 consecutive readings, and if they are high, definitely you have hypertension. But we don't use that judgment a lot in Africa, because many people come to us when their blood pressure is 200, and obviously if you assess them clinically, they have symptoms of hypertension. Then definitely you will have to start them on treatment, because you don't know when they'll come back again. So you just have to start them, even if it's lifestyle, then give them 2 weeks, they come back. So that's why one day when you go to a hospital, a doctor will tell you have hypertension. This is a crisis. We have to start you on treatment. But for other cases, we want to test today, tell you to come back after 2 weeks, we test again. Yeah. And just a disclaimer, there are people who confuse hypertension with stress. Hypertension is not stress. High blood pressure is not stress. When you tell somebody that they have high blood pressure, the next answer they tell you is, I don't have stress.
Any stress, yes.
So why do you tell me I have hypertension? Hypertension has so many factors that we're going to look at. Yeah.
Now, deep into the hypertension discussion like this, what can we attribute to be the cause of hypertension apart from lifestyle, or we can say lifestyle is the main cause?
Yeah. Before we come to the causes, we have actually two causes, or maybe two classifications of hypertension. We have primary, or what we call essential hypertension, and we have secondary hypertension. So secondary hypertension, if I may start with, it affects the young people. Mostly you will find people who are below 30 years, 35, even 2 years, 3 years, they have hypertension. And the reason why these people have hypertension is because there is a cause that is causing that hypertension. And most likely, if you remove that cause, these people won't have the hypertension. For example, a young lady who is pregnant can have hypertension because of the pregnancy. A person who has kidney disease can have hypertension because of the kidney disease. A person who uses drugs, like those people who inject drugs, there are people who are using nicotine, there are people who are using cigarettes, a lot of tobacco, there are people who are using intoxication of alcohol. When they stop taking alcohol, when they stop smoking, likely they might go out of hypertension. Then there are people who have diseases like goiter. Goiter will lead to hypertension. If you have a large goiter, it can cause hypertension. If you have a kidney disease, if you have a cancer of the kidneys, it can cause hypertension. So that's why we need to really check and see if this person has a problem with the kidneys, then it has to be fixed, because it will lead to hypertension. And we have other diseases like Cushing's disease. There are children who are born with palsies like cerebral palsy. There are children who are very obese when they are young, and it's because of maybe a steroid disorder in their body. Bring them to the hospital, we check, we treat, or else it might lead to hypertension. Then we have the primary hypertension. Primary or essential hypertension is the most common. It affects mostly adults. It has no cause. We call it in medical idiopathic. That's why when people relate hypertension to stress, the cause of hypertension related to stress is very minimal. Hypertension, essential hypertension, basically has no cause. It comes on its own, but there are risk factors for that. A good risk factor number one is age. As you count your birthdays, you are heading closer to hypertension, unfortunately. So the more you add your years, the more you are getting closer to hypertension. I know it's not a very spiritual statement.
It's true.
It discourages.
It discourages growing up.
Yeah, but again, it is science, and we have to accept, it's just like gravity. There's no way you can refuse gravity. If you lose balance, you fall down because of the force of gravity. So again, because of age, you can get hypertension. That's why we're encouraging the people who are aging more, they need to check their blood pressure. Another thing is obesity, increased BMI. So if you have a lot of weight, you need to check with your doctor if it's okay for you, because you might be having a lot of weight and maybe you are short. Somebody who is short, they need to have less weight. Somebody who is tall, they have their amount of weight. So it goes by your height. If you are, the taller you are, the more heavy you are supposed to be. The shorter you are, the less heavy you are supposed to be. So that's what we call body mass index. Then I'm not defending myself because I'm tall, but at least there is that threshold. Then the other thing is salt intake, and that is what affecting the low socioeconomic communities. You will realize that people in the villages are using a lot of salt. The salt shakers, those salt shakers are not good. So they will lead to hypertension, because if you use raw salt, it will lead to hypertension. Then the risk factors are so many. Lifestyle, what you talked about. Since the inception of motorbikes and vehicles, the old days of our parents, they used to use bicycles, they used to walk. But nowadays, people no longer use bicycles, people no longer walk, so they use motorbikes or vehicles, and this is leading to hypertension. That is what is causing problems. Plus diet, people are eating, and nowadays you go to the village, you will find nyama at 20 shillings. I don't know if you've seen that.
Yeah,
during our days, you couldn't buy nyama at 20 shillings. Because they are using those weighing scales, the metallic ones. But nowadays they are using the digital ones. It can even give you meat at 10 shillings. And you just eat it. You can even eat meat every day if you have 10 shillings. So you realize that somebody tells you, I don't eat, but they are eating meat every day at 10 shillings. Definitely it will lead to hypertension. We have the kangumus in there. People sell maize to buy kangumu for breakfast. You realize? Instead of boiling that maize, which is better than the kangumu. So definitely, this kangumu has a lot of oil, it has a lot of salt, it has a lot of sugar. So definitely, it can lead to hypertension. Plus so many other risk factors that I cannot exhaust today.
Now, when you talk about maybe lifestyle, about exercising and maybe bicycle riding for work and relaxing, is it associated with accumulation of toxins in the body that causes that, or it's another way around?
No, what happens when you don't exercise, definitely your body's metabolic function works as a different threshold compared to somebody who exercises. When you are running, for example, your heart will pump very fast. But when you are seated, your heart does not pump. So what happens, your body will accumulate what we call a lot of cholesterol. Then the metabolic threshold will increase. So when it increases, it means anytime you get a risk factor, you will get that hypertension. So people have to exercise, because when you exercise, number one, you will watch your weight. You won't accumulate a lot of fats in your body. Number two, you will utilize every kind of food that you eat. Because when you eat ugali, and people know how they eat ugali, the size of ugali. So why should you eat a lot of ugali and yet you are not going to work? If you are not going to work, eat less. Because You eat so that you get energy to work. That was I think in class 3.
Yes.
Eat so that you get energy to work or play. But if you're not working or playing, why are you eating a lot? So eat a lot so that you can get a lot of energy to work and play. So those are the things that we need to factor in as we prevent hypertension. People need to know their meal plans. People need to know the portions of food that they need to eat so that they can prevent hypertension.
In the beginning, you say that there are no symptoms that are displayable for hypertension.
Yes.
How does one know that I'm having hypertension right now?
A very good question. People have to come to the hospital for screening. The first sign of hypertension is screening. No other sign. The first sign of hypertension is screening. Because when you screen, the doctor will tell you that you have hypertension or you don't have hypertension. So another sign of hypertension now in later stages. By the way, when hypertension gives you symptoms, just know that you are lucky that it has given you symptoms. Most cases of hypertension, high blood pressure, they make people fall down or collapse. That's when they realize. But if you are lucky, probably you usually go to church. That's when it will give you a headache, it will give you a chest pain, it will give you swelling of the limbs and other symptoms. You'll get tired easily, you'll get angry easily, it affects your moods, it affects your visibility, you can't see well. Even sometimes it might block your urine. So those are the symptoms of hypertension. Palpitations, the heart can race very fast.
Yes.
And if you notice such symptoms, just come to the hospital. But occasionally, you have symptoms. So just come to us, let's do the blood pressure, we'll tell you.
All right, Daktari, just hold on there. We take a short break here on health, hygiene and wellness. We'll be back with much more. I hope in the second half we'll be able to discuss about the systolic and diastolic blood pressure, as well as discuss about the May measurement. Yeah. Okay, we'll be back right after this break.